the video?
Yep, there it is.
Thanks.
Quite a perspective. Hard to get that kind of surround in such a small little.
What's your perspective?
Oh, just I'm visually. The IMAX style. Hi, Madam Surgeon General. Nice to meet you. So what brings you to campus?
The Trojan Above campaign. The thing that brings me to Georgia campus today is the Trojan Above campaign to help to deal with our sexually unhealthy nation.
Now, is this a national tour? Are you going to a number of cities?
This tour is going to go to a number of cities. We've planned at least 50 cities across the United States and, college campuses.
How do you think, how is the country doing currently in terms of its sexual health policies?
In terms of our sexual health policies, we as a country are doing poorly. We rank behind all Western nations in terms of teenage pregnancy, sexually transmitted infections, and our HIV cases are very high. Every year in this country, we have 19 million new STIs, and many of them are uncurable, with 65 million people living with an incurable STI. So we're not doing very well at all.
Has it been this bad for the last decade or so, or are we on an uptick or a downslide?
In terms of whether we're on an uptick or downslide, from 1991, we had really been going down in the number of STIs, the number of teenage pregnancies, and however, in 06, we started up again. And I think it's because we're losing some of our fear of HIV.
Mm-hmm. It's certainly not in the public conversation anymore.
No. There was a time when we would just, you ask anybody, everybody about HIV because we were all petrified that we have a higher prevalence. We have more cases of HIV now. It's just that people aren't dying because of our drug therapy, but it's not a cure. We do not have a cure for that disease, and if our drugs ever stop working, we may have lots of death very quickly.
Thanks very much.
You're very welcome.
Have a good trip.
Thanks.